Hey, good morning to you. Friday here at iFiber One News Radio. I'm Jeff Slakey. Third day of November. I've got a great guest in studio right now. North Mason Regional Fire Authority Chief Beau Bakken. Morning, sir.
Morning. How are you?
I am well. Thanks for that
Wonderful.
breaking news on the snow on the way in here.
Crazy. I was out there coming in from the canal, and it was almost impossible to see. It was coming down sideways out there on the canal.
Oftentimes it's a little heavier up there when it comes down, too. Right?
It is. You know, when you get into that, I guess it's the convergence zone or whatnot, but you get right around that lower Hood Canal area and whatnot, and the snow just accumulates. Seems like a lot more in that area. It's crazy.
Well, we'll keep our eyes on that for sure. Last week or 2 weeks ago or so, President Trump declaring the state of emergency for opioids. Earlier in the week, actually, it worked out nice. We had Mason County Sheriff Casey Salisbury on, and we talked just about that as well. And it leads us into our conversation here today. And there was a conversation in the south part of Mason County about the opioid epidemic, now going to be in the north part of the county. When is it, and what are we going to be talking about?
So on the 15th of November, so we're coming up in about 2 weeks, we're going to be having a opioid forum. It goes from 5 p.m. to 8 p.m., and it's going to be at the North Mason High School Commons. And one of the things that we were seeing in emergency services is that this opioid epidemic, I mean, we're obviously hearing about it on the national level and whatnot, but it is right here in our backyards. And I've been in the fire service for about 20 years, and we are running more opioid-related calls now than we ever have at a significant greater level. The number of overdoses that we're seeing and the more number of prescriptions that are out there, and it's not just the overdoses. I think that those get obviously a lot of attention. It's kind of the far end of the spectrum as far as what happens to patients and folks that we see, but it's also the health complications. It's the effects that these are having on every demographic in our society. And what I would like to really point out is that this is an epidemic that is affecting every demographic. This is not just a down and out problem. The other thing is this is not just an inner city problem. Of course, as we listen to the radio, we watch on the news, we see issues in our urban cities, you know, downtown Seattle and Tacoma and whatnot, and we're seeing our larger cities tackling this issue. But this issue is right here in our backyard, and it's our neighbors, it's our mothers, it's our relatives, it is people that are close to us. And so one of the things that I wanted to do with the Fire Authority, I got a chance to attend that forum that was very well put together down here in the south part of Mason County about a year ago. And I was blown away by the attendance. And the other thing that I was blown away was the amount of folks that are out there that are seeking help and having difficulty finding it, not knowing where to turn when they have some type of problem going on, either with themselves or within their family unit. And so what I did just about 2 months ago is I asked for a group of stakeholders to come together, and what I wanted to do was to get kind of a perception of and a perspective of how this epidemic was affecting other entities or agencies. And so, of course, I know how it was affecting our fire folks, but I wanted to know what was the effect on law enforcement and schools and nonprofit agencies and churches and local medical clinics and government services. And so we met about 2 months ago at the North Mason High School, and we got a chance to kind of go in a round-robin fashion and just talk about how the epidemic is affecting these different sectors within our society. And I was blown away. It is amazing how rampant these issues are in our schools and all those different entities that I was talking about. And so what I asked for this group is, can we do something about this? We obviously got a chance to talk about it in the south part of Mason County. I think it's about time we talk about it in the north part of Mason County. And everybody in the room agreed, and hence we sent the date for the 15th. And we have a lot of folks that are working on behind the scenes to make this happen. And one of the things that, you know, I know that there's a lot of national statistics, and one of the statistics that blew me away locally is that we have the second highest death per capita rate in Washington State. We're just behind Mason County. We're at 14.7 deaths per 100,000 people. Wow. So this problem is very much in our backyard. It's not just an urban issue. And so that's one of the things that I'm trying to, and I say we as a group are trying to kind of bring to the forefront and to people's attention is that this issue is in our backyard. It is here in Mason County. It's definitely in North Mason County. And again, this is not just I hate using this word, but a junkie problem.
Sure.
This is, we are seeing it in folks that are 75 years plus that have an addiction problem that are very well to do. This is not just a problem that's affecting, again, a stereotypical crowd.
Is this morphed from the methamphetamine epidemic we had in the county kind of in the early aughts to some of the ways that people were getting prescriptions to even help with the treatment of those kind of problems?
No, you bring up a very good point. When I started back in the mid '90s here in Mason County in emergency services, methamphetamine was the number one problem. We were going to meth labs on a regular basis. Meth was all over the place, and not that it disappeared, but it doesn't seem to be the problem that it was back in the '90s. Opioids have taken over that void, unfortunately. And the difficult thing about opioids is that you can get them at your local pharmacy.
Yeah.
You can get them at your doctor's office. You can get them through a prescription. I mean, they're readily available. Methamphetamine obviously is not. You gotta go through some pretty difficult procedures to make it, but opioids are readily available. And one of the things, if I could pitch real quick, which a lot of people don't know about, is we have here in Mason County, thanks to a partnership with public health and our hospital districts and law enforcement, is we have a drug take-back program. And outside of our fire station on the old Belfar Highway, and also in front of the sheriff's office here in Shelton, we have a black box. It's labeled and placard, and it's for people that that have medications of any type. It doesn't have to be just opioids, but where they can take and dispose of those medications in a safe fashion. And one of the problems that we see is that folks will get a prescription, let's say for opioids, and they might have a sore tooth or they've got some type of pain control issue going on. They don't need the entire prescription, and then these bottles sit in cabinets for sometimes years.
Yeah.
Young people get involved, or people get into medicine cabinets and whatnot. Those medicines are readily available, and what we're asking people to do is, if you're done with those medicines and don't need them anymore, bring them to our drug take back box program. From there, once it's in the box, it's alarming how much medication comes into those. It's unbelievable as it's picked up over the years. But the sheriff's office then comes in on just about a weekly basis and then empties that box, and then those medications are incinerated and they're taken off the streets and off the markets. And so we're trying to encourage anybody that has back medications and stuff that they're not using and won't be using, to get them into the right receptacle, to get rid of those, get those off the street, so they're not plaguing, I guess, our streets out here in Mason County.
Yeah. Who are some of the folks that will be in attendance next week?
So we're going to have, I kind of listed a little bit of we're going to have our school districts going to be involved. We're going to have our public health involved. We're going to have our county commissioners that will be there. We'll have state representatives that will be there as well. We're going to have our nonprofits. We'll have churches. And the format for the forum itself, we're going to have a kind of a more regional speaker. Dr. Caleb Banton Green's going to come over. He's with the University of Washington, and he's also on the King County Heroin Task Force, and he's very involved regionally on this particular issue. He'll be our keynote speaker for the evening, and then from there we're talking maybe more of a regional issue and what the opioid epidemic is doing regionally and nationally. We're going to then transition to Dr. Yu, who I know that you've had a chance to talk to, will be then talking about really what's happening in Mason County and talking about some of the statistics and the effect and the impact that it's having on public health in Mason County. Once those two speakers are done, then what we're going to have an opportunity to do is we're going to have breakout sessions, and we will actually have facilitated discussions on what is it that we can do and what is available for helping in this particular epidemic, and we're going to allow attendees to choose and pick what type of action they would like to help out or work in trying to overcome this epidemic in Mason County. And so we'll have one of the breakout sessions will be medicated assisted treatment, and what does that look like? An abstinence-based treatment. We'll be discussing the needle exchange program that's here in Mason County. We'll be talking talking about Narcan and the I guess the antidote that's used to overcome opioid overdoses that we have there on the street. And interesting, speaking about the needle exchange program, and I know that this is in Mason County. This is a number that blew me away, and it came from Kitsap County Public Health that I just got about 2 weeks ago. But they have a needle exchange program similar to what we have here in Mason County. I know that they're a little bit bigger as far as population than we were, but last year alone they did 1.4 million needle exchanges.
Wow.
In Kitsap County. Now, of course, North Mason, we kind of straddle the border there with Kitsap County, but it just gives you a little bit of an insight. 1.4 million needle exchanges that's happening out there on the streets. It's incredible.
Where and when again is this?
We're going to be at the North Mason High School, brand new high school in the Commons area, beautiful facility, and we'll be using classrooms there as well. It's going to be November 15th, and we're going to start promptly at 5 o'clock. We'll be out of there by 8 o'clock.
North Mason Regional Fire Authority Chief Beau Bakken talking the opioid epidemic, a conversation you do not want to miss. Good to see you this morning.
Same here, Jeff.
Have a
Thanks
good
for having
weekend.
me.